Let's talk about the opioid crisis and the false narrative. This false narrative is rooted in media reports and the politicians telling us the way to fight the crisis is by stopping doctors from prescribing opioid painkillers. But now we're seeing editorials where doctors are pushing back. The medical community says stopping prescription opioids won't end the crisis, but it will prolong the suffering of those with serious chronic pain. There was a time when the focus should have been on doctors and their opioid overprescriptions, but that horse left the barn years ago. We realized that drugs like OxyContin were addictive. We saw how they'd become a gateway to cheaper illegal opioids like heroin and fentanyl when we cut back or we cut off opioid prescriptions. What's the story people miss? The Centers for Disease Control show that heroin and fentanyl now account for 70% of opioid deaths. So you can still blame doctors, maybe this much. But the reason so many people die is that people don't get the treatment they need. So what's changing in Michigan? A new law stops doctors from prescribing more than 7-day doses of an opioid at one time. Another law tracks doctors in real time as they prescribe opioids. Creating more regulations and more paperwork is easy. Providing the treatment is hard, and that's really what we need to do. In Michigan, we spend about $30 million a year, but half of it goes to abstinence-based therapy. The trouble is that's not very effective. The odds are patients will return to opioids again and again. What really works? It's called medication-assisted treatment, or MAT, which you might say is diametrically opposed to the cold turkey approach. Patients use drugs like Suboxone and methadone that replace the opioids and remove opioid cravings so they can return to society as productive citizens. With a success rate of more than 70%, what's keeping MAT from really taking hold? Addiction experts say we need to shift the money from abstinence to MAT, but our public servants need the political will to make that so. Now, some say MAT just feeds one addiction over another, and some don't want MAT clinics in their neighborhoods because it brings in those people. Who are those people? There are kids, relatives, friends, neighbors, and co-workers. That's the real narrative we've been trying to convey here in Michigan.